and I would like to share the following presentation titled Responsible Use of Antibiotics in Animals to introduce to you why all antibiotics must be used with care and how to responsibly use antibiotics to treat food and companion animals. What are antibiotics? Antibiotics are drugs used to treat bacterial infections. If an animal is not suffering from a bacterial infection, an antibiotic will be unlikely to help its condition. There are several ways by which antibiotics are used in animal health. One of the most easily recognized uses is to relieve illness and suffering in animals caused by bacterial infection. Another means by which antibiotics are used in animal health is to prevent infection. Antibiotics may be administered to prevent infection when bacterial pathogens are suspected or known to be in the animal's environment, or when an animal encounters high-stress situations that increase its susceptibility to infection and disease. In addition, the use of antibiotics in animals can minimize the transmission of pathogens from animals to humans. By minimizing bacterial infections in animals, antibiotics may reduce the opportunities for pathogenic bacteria to be transferred to people who have direct contact with animals and/or consume animal products. When used appropriately, antibiotics are powerful tools for maintaining healthy animals. However, when antibiotics are used in the wrong manner, the consequences can be serious. 4 important reasons why we should use antibiotics responsibly are to ensure their effectiveness in treating the condition for which they were administered, to minimize the costs associated with their use, to prevent the occurrence of antibiotic residues, and to minimize the ability to promote antibiotic resistance. It is important that everyone who administers antibiotics to animals understand and be willing to follow the responsible use guidelines. One concept to realize is that your role as an animal owner or caregiver means that ultimately you decide how antibiotics will truly be used in your animals. The goal of responsible antibiotic use guidelines is to provide the best care for the animal and protect public health. The guidelines for responsible antibiotic use can be divided into several categories based on the animal's health status and the phase of treatment. Before animals get sick, the first guideline is to provide a system of care to prevent common diseases. If illness does occur and you are considering antibiotic treatment, the following guidelines should be applied. When animals do get sick, have an accurate diagnosis. Determine antibiotics are the most appropriate treatment option. Choose the most appropriate antibiotic for the circumstances and work with your veterinarian to enhance therapeutic options. Once an antibiotic has been selected for use, use the antibiotic as ordered. Treat the appropriate animals. Store the antibiotic as well as other medications appropriately and minimize environmental contamination. The final guideline applies once you have used the antibiotic. Use records to track treatments and evaluate outcomes. By following these responsible use guidelines, you will help ensure your use of antibiotics is effective, cost-efficient, and less likely to result in residues and the promotion of antibiotic resistance. Are you prepared to make the best decisions about using antibiotics in animals? you want more information, it is available in the NEB Guides, Guidelines for the Prudent Use of Antibiotics in Food Animals, and Prudent Use of Antibiotics in Companion Animals.